Wegovy or Zepbound can reduce appetite while making IBS symptoms better, worse, or simply different. The practical question is not just whether you have irritable bowel syndrome, it is whether constipation, diarrhea, or both dominate before treatment. Wegovy and Zepbound are not IBS treatments. Their digestive side effects can overlap directly with the symptoms you already have during weight loss treatment. Wegovy contains Semaglutide and Zepbound contains Tirzepatide. Both delay stomach emptying and help smaller meals feel satisfying. They also commonly cause constipation or diarrhea. Those effects can overlap with IBS, especially after treatment begins or the dose rises. Irritable bowel syndrome causes repeated abdominal pain with changes in stool frequency or consistency. It usually does not cause visible bowel damage. Symptoms can still be intense because the bowel reacts strongly to stretching, meals, stress, and normal movement. The first distinction is your usual stool pattern. Constipation-predominant IBS means hard stools are the main pattern. Diarrhea-predominant IBS means loose, urgent stools dominate. Mixed IBS includes both, so medication side effects can make the pattern harder to read. For constipation-predominant IBS, treatment can stack one problem on top of another. Someone already having hard stools every 3 days may become more bloated if constipation worsens. Eating less also produces less stool, making bowel movements even less frequent. For diarrhea-predominant IBS, smaller meals and changed food choices can sometimes reduce urgency. Less greasy food, alcohol, or other personal triggers may help. Wegovy and Zepbound can also cause diarrhea during dose increases. Diarrhea may therefore improve or worsen after treatment starts. Mixed IBS creates the most confusing pattern. Diarrhea may improve for 2 weeks, then constipation may appear after the next dose increase. The medication can shift an already variable bowel pattern. Tracking the sequence matters more than judging one isolated day. In Wegovy weight loss trials, diarrhea affected 30% of patients and constipation affected 24%. Across Zepbound weight loss trials, diarrhea affected 19% to 23%, while constipation affected 11% to 17%. Both bowel problems were common during treatment. Tracking your symptoms shows which effect is happening to you. Those trials measured side effects in people using the drugs for weight loss. They did not specifically study people with IBS or compare IBS patterns. These percentages describe overall side effects. For tolerance, your symptom pattern matters more than these percentages. Before starting, record your normal bowel pattern for at least 1 week. Note stool frequency, stool consistency, abdominal pain, bloating, and bathroom urgency. A baseline helps separate a true change after treatment from symptoms already present beforehand. Timing helps separate medication effects from normal IBS changes. Symptoms that repeatedly worsen after starting or increasing a dose deserve attention. A flare that repeatedly follows one meal suggests a food trigger. Symptoms clustered around stress, travel, or poor sleep may reflect usual IBS triggers. Apparent improvement can come from eating differently rather than from the injection treating IBS. One person stops fast food and feels better. Another eats too little, drinks less, and becomes constipated. The same medication can feel different because meal size, food choices, and hydration change too. A strong result on the scale does not settle the bowel question. Weight loss may be excellent while pain, urgency, or constipation becomes unacceptable. Treatment remains useful only when the appetite and weight benefits are worth the digestive symptoms, and those symptoms remain manageable. Changing the injection day rarely solves symptoms that persist throughout the week. Both medicines remain in the body between weekly doses. A problem that repeatedly follows dose increases suggests a medication effect. A brief reaction after one specific meal points more toward that meal. If bowel symptoms are uncontrolled, do not raise the dose yet. Contact your prescriber first. A scheduled increase is not a deadline. Your prescriber may keep the current dose longer, reduce it, or reconsider treatment. Forcing a dose increase can turn manageable symptoms into a reason to stop completely. Meal size is another major control point. Large, high-fat meals can intensify fullness, nausea, heartburn, and bloating when stomach emptying is delayed. Smaller meals eaten slowly are usually easier to tolerate. These drugs still do not treat IBS directly. The goal is reducing symptoms triggered by meals. Fluid intake can change the entire pattern. Diarrhea and vomiting remove water, while lower appetite may reduce drinking. Dehydration then makes constipation harder and more painful. Drinking regularly through the day is easier than trying to catch up at night. For constipation, soluble fiber such as psyllium can improve stool consistency, but adding too much quickly can increase gas. Some people also need an osmotic laxative, a medicine that pulls water into the stool. These measures target constipation. Persistent pain or severe bloating may need separate IBS treatment. For diarrhea, first remove triggers that clearly worsen urgency. Large fatty meals, excess caffeine, alcohol, and sugar alcohols are common examples. Change one major factor, then watch the next several days. If urgency continues, compare its timing with your injections and usual IBS pattern. The useful pattern is whether symptoms keep returning after injections or dose increases. One loose stool tells little about the cause. Repeated urgency, worsening pain, or several days without a bowel movement carries more weight. Trends across several days are more useful than one bowel movement. Pain requires a separate check because not every painful episode is IBS. Typical IBS pain often changes after a bowel movement and occurs with harder or looser stool. Constant severe pain, repeated vomiting, fever, blood in stool, or increasing abdominal swelling requires medical evaluation. Being unable to pass stool or gas with increasing swelling can signal a bowel blockage. Persistent vomiting can cause dehydration and kidney injury. Severe upper abdominal pain, reaching the back, can indicate pancreatitis, meaning inflammation of the pancreas. These symptoms need prompt medical care. Gastroparesis means the stomach empties abnormally slowly. It can cause prolonged fullness, nausea, vomiting, and difficulty keeping food down. Irritable bowel syndrome and gastroparesis are different conditions. Neither Wegovy nor Zepbound is recommended for people with severe gastroparesis. Without severe gastroparesis, IBS still does not tell you which drug will suit your bowel better. Separate Wegovy and Zepbound trials enrolled different people, so their side effect percentages are not a direct comparison. No direct IBS study shows one is consistently gentler. Your own bowel response becomes the practical guide. Whichever drug you use, first learn your usual symptom pattern. Keep meals smaller, drink regularly, and avoid increasing the dose during an active flare. Track each injection, major food trigger, bowel movement, and pain level until a consistent pattern appears. Continue when appetite control and weight loss are meaningful while bowel symptoms remain manageable. Contact your prescriber before the next dose when symptoms repeatedly worsen after dosing or a dose increase. The plan needs adjustment when hydration, nutrition, sleep, work, or normal activity is disrupted. Having IBS does not make Wegovy or Zepbound automatically unsafe. Your dominant bowel pattern tells you which problem deserves the closest watch. Constipation needs greater caution when hard stools already dominate. Diarrhea can improve with changed eating, worsen as a drug side effect, or later shift toward constipation. Judge treatment by 4 things: stool pattern, pain, hydration, and daily function. Weight loss alone is not enough. If all 4 stay acceptable, continuing treatment can make sense. If they deteriorate despite slower dose increases and basic symptom control, the medication plan needs to change. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.